Well, for more, Dr. Cary Adams joins us now live from Geneva. He is the CEO for the Union for International Cancer Control. Thanks so much for speaking to us. What I actually found really remarkable is that a significant part of cancer diagnoses today could be preventable simply by not engaging in behavior that we've long known is unhealthy, like smoking and eating unhealthy foods that cause obesity. So why don't people want to engage in better behavior?
I think that's a challenge that individually we all have, and that we're aware of certain risks to our life, but we somehow manage to avoid those stark realities. For example, drinking or smoking. People are aware of the risks of smoking. They understand that it will give them a greater chance of lung cancer and other diseases in the future. But we still have billions of people who still smoke because they are marketed to by an industry which is very intent on winning them over to take on the smoking at a young age and continue through their life. So it is difficult to change a habit, particularly when it comes to tobacco, where there's a nicotine addiction included in the act of smoking. Having said that, there's a lot that can be done. Education is great, imposing taxes on tobacco, warnings on cigarette packets make a big difference. We know that. We've seen that in countries that have really been very clear on how they can address at a government level through policies changes in the way that those risk factors are presented to society.
But even more challenging in the prevention is knowing that the rise in cancer rates is becoming more and more of a problem in developing countries that actually have the fewest resources to deal with it.
Yeah, that is very distressing. And the report that you just showed highlighted that from the World Health Organization, figures that we would completely and totally agree with. Unfortunately, we're in a situation with an aging population in lower middle income countries. We've also got a large growth in population in low middle income countries. And that means that 70% of the growth in cancer incidence and death in the future will be in those countries. The countries that are least prepared to actually address the burden they're facing. They don't have the technology, they don't have the drugs, they don't have the human resources to do that. And hence the call to action for governments around the world is to make sure that they put cancer as a health priority in their health plans in future years.
And I mean, how far do you think we are from seeing truly effective treatment for cancer? I mean, possibly even a vaccine?
Well, we made great progress in the last 20, 25 years on some cancers. I mean, if you look at, for example, cervical cancer, cervical cancer is predominantly caused by a virus, HPV, human papilloma virus, and there is a vaccination which can be given to young women at an early age, which actually eliminates the chances of cervical cancer during their lifetime. And we've seen recently in Australia that they've made an announcement through doing vaccinations and doing screenings that they are essentially going to eliminate cervical cancer in their population by 2025, 2030. So there's an example of a cancer that we can address. However, there are over 180 cancers, and there are some others that we can address when they're caught early. But the majority of cancers, if they're caught late at stage 3 and stage 4, when they've moved around the body away from the local site, they're incredibly difficult to actually treat. So we struggle to treat cancers beyond stage 3 and stage 4. But early stage cancers, a number of them can be treated very, very successfully today.
Okay. Dr. Cary Adams, we will have to leave it there. Thank you so much for joining us from Geneva.